Welcome to Growing Younger podcast, where we guide you through your journey of reaching your fitness goals after 40.
Hello guys, and in today's podcast we're going to talk about knee replacements, so knee arthritis leading to knee replacements, but most importantly we're going to talk about the alternatives. What are your options? What are the alternatives to having a knee replacement? So my name is Alex Blaževski. I'm a physiotherapist from Growing Younger Fitness, and the topic of today's podcast is the alternatives to having a knee replacement. So for a few decades now, your only option was, once you get to a point where your knee has had it, you go to see your doctor, your GP. They'll obviously for quite some time they'll prescribe you some pain medications. You keep taking them until you get to the point where you can't take it anymore. The pain is becoming too much. It's becoming too debilitating. It affects your day-to-day life. And the next step essentially has been go and have your knee joint replaced. Okay. Now, the good thing is that science has not been standing still over the last few years. So in today's podcast, I'm going to bring you 5 relatively new discoveries, particularly I would say in the last couple of years they came through, that may potentially change the way we think about knee replacements, and possibly in many cases we might even be able to avoid having a knee surgery, knee replacement in the future. So the first thing the first discovery that I'm going to mention is going to be, there was a massive genetic study done in Europe, in Germany. In fact, they completed the study, they published the study this year, so it's very new. They basically followed up 2 million people with and without arthritis, and they look at their genes. So particularly they looked at their DNA markers. So DNA markers essentially are the bits of your DNA that are responsible for a certain aspect of your health. So in the case of osteoarthritis of the knee, they've actually identified a number of these markers that if you have it in your body, it makes you more likely to get osteoarthritis. Now, the really amazing thing is that these DNA markers, they produce proteins, which is what actually gives you the symptoms, or what actually gives you arthritis is the fact that these DNA markers actually create this protein, which essentially results in you getting arthritis. So what they've actually found in the study as well is that there's a number of existing medications or drugs, if you want to call them. So there's a number of existing drugs that can actually interfere or suppress the production of these proteins. So these are essentially the proteins that make you, well, not sick, but essentially it gives you the arthritis. So there's a number of existing drugs that can actually, if you take them, it will help to suppress these proteins, essentially modifying the whole disease process of arthritis. So let me just repeat this again, just to make it very clear. So basically these drugs, they would be able to not just give you pain relief, which is what it is currently. So when you go to the doctor, they just give you pain relief, which is just masking the pain. But if we take this approach and you take these drugs, which actually target pretty much the source of the problem, which they will actually help to slow down and basically, maybe not completely stop, but it will help to target the very source of the osteoarthritis. Okay, so this is very promising. It's quite a complex area, so it may sound a little bit hard to understand, but essentially the genetics there's a lot of new things that are coming through, and particularly this aspect, it's not quite available yet, but I think in the next few years, it could be a very promising treatment that could target not just the symptoms, not just the pain, but actually it could be a disease modifying treatment. Okay, so that's number one. Number two, this one is actually really interesting as well, because again, a very recent study has found that if you take a person with arthritis and you give them training on how to walk, and depending on exactly which part of your knee is affected by arthritis, you get them to walk a certain way. So it usually means walking with your toes pointing in or out. If you get the person to walk like that, it actually helps to reduce their pain levels, and the reduction in pain levels is either the same or even greater than what you would get by taking pain medications, which is quite amazing. So you can get the same level of pain relief by changing how you walk, as if you were taking pain drugs, okay, which is really amazing. Now, the other cool thing about that as well is they followed up these people over a period of time. And so if the person keeps walking this particular way, it will actually slow down further degeneration of their knee joints. So not only helps the pain, but also it helps to slow down the actual wearing out of the knee joint. So very, very cool. All right.
Look, guys, hope you enjoyed the podcast. Look, I have a little favor to ask you. If you know someone who this podcast could be useful for, I would really appreciate if you share this podcast with them. It would help them, but also it would help me grow the channel as well.
Now, number three. This one sounds like it's literally straight out of the science fiction book, okay? So what the scientists have actually found is if you take a little tiny amount or a little sample of the cartilage from inside your nose, then you take it to the lab and you grow that cartilage tissue in the lab for a period of time until it's enough of it to put inside your knee joint. So essentially this new cartilage can, to a degree, replace the cartilage that's been lost through arthritis. Okay, now because it is your own tissue, it's a lot less likely to be rejected by your body. So there's a lot less risk of complications. And the early data that we have, it's very promising, because they actually found that patients that had this done had significantly less pain and they had much better improved function. Again, this type of treatment is not publicly widely available yet, but it is definitely a space to watch, and it is a minimally invasive procedure that potentially could actually avoid or at least delay knee replacements in the future. Okay, now number four, this one is probably the most realistic, and it is something that to a degree is available now. Now it is actually being very much I guess used probably the most in India out of all places. So it's a microplasty partial knee replacement. So partial knee replacement can, as I said, can be done even now. So the principle behind it is that very often when you have to have a knee replacement done, not the whole knee is actually affected by arthritis, but only a certain part of it, a certain section of your knee joint is actually worn out. So the principle is that rather than replacing the whole joint, you just take that bad part of the knee and you replace that part. Okay, so there's less, like it's a less invasive procedure, less complications, and the recovery is faster. Okay, so this is, you know, if you're looking for I guess a low scale surgery to help you improve your function and reduce pain, this potentially could be an option, and it could be an option that, you know, you may have to speak to your surgeon and see if it is something they can actually do for you right now. Okay, now just to explain microplasty, It just stands for, it's a certain system it's a surgical system where they use very high-tech precision tools to make sure that they put prosthetics, or they put the implants exactly where they need to go. So it just improves the accuracy and precision of the procedure. Okay, and the last but not least, so again, this is something that actually sounds a little bit like science fiction, but let me explain. Okay, so this last discovery, what it involves, essentially, the scientists have actually taken stem cells from your adipose tissue, so basically from your fat. Okay, they take a sample of stem cells, then again they put it through a certain process, and then they inject those stem cells into your knee joint. Okay, so stem cells are known to help to reduce pain levels, to reduce inflammation, and to also help the repair of tissues. So far, the clinical studies have actually shown real benefits. So these benefits include reduced pain, improved function, and they even did some MRI scans on people's knee joints, and they actually found that people knee joints have been treated with these stem cells, their cartilage actually looks healthier after they've been injected with these stem cells. So again, this one is not quite available yet on the mass scales, on the mass scale, but it is definitely something to watch, because this is is another one of those very minimally or invasive procedures that once they're proven 100% and put on a conveyor belt, this could definitely be something that may potentially replace the need for having a knee surgery done. Okay, so hopefully that gives you a few more things to think about. Now, look, I'm not a doctor, so I don't want to be saying that you shouldn't be. If your surgeon told you should have a knee replacement, then my best advice is to listen to your medical professional. However, it's just food for thought. If you thought that you may need a knee replacement in the next few years, well, there's a few things in the pipeline that you may need to consider. As I said, the science is not standing still. New things are being discovered, new things are being tested. At the moment, there's quite a few very promising developments in that area of medicine that potentially a few years down the track may enable us to avoid knee surgery. Okay, all the best for now, guys, and I will speak to you on the next podcast.